Oh, there's so many things I'm proud of in 2022 because we were still in the throes of a pandemic. Yet we kept our system up and running through our partnerships. We, as a system of care, accomplished a lot. Our team goes above and beyond what's called upon in order to earn a paycheck. Being very closely aligned with the community, being accessible, and being present in a variety of places where you would not typically find your traditional mental health system. And we do it without worrying about who gets the credit. We want the community to get the credit, and we continue to find ways to make that happen. I'm just really proud of our talent. We launched initiatives during that period as well. So last year, we had a really heavy lift. We had the new Crisis Now system, and that was a true system of care that we were inserting into our behavioral health system during a time when we had a workforce shortage and other things going on.
We wanted to make sure that someone who was experiencing a behavioral health crisis could access services 24 hours a day, 7 days a week. We wanted to partner with RI International because they are delivering a brand new, innovative model of care when it comes to delivering crisis services called Crisis Now. Crisis Now is a three-pronged approach to helping people who are experiencing a behavioral health crisis. And those three prongs are someone to call, someone to come to you, and somewhere to go. So on January 1st of 2022, the Crisis Call Center launched here in Montgomery County. At that same time, mobile crisis response teams were then available to go to the individual who was experiencing a behavioral health crisis. This is something new and never done before in Montgomery County, and we're very proud we were able to offer this level of service. And we're very excited to share that in early 2023, that third prong will be implemented. The Crisis Receiving Center will open inside 1 Elizabeth Place, and that will be the somewhere to go. This is somewhere that will be open 24 hours a day, 7 days a week for an individual who's experiencing a behavioral health crisis to walk in and immediately receive services. The other terrific advantage of the Crisis Receiving Center is this is a place where law enforcement officers can bring an individual they are trying to help who's experiencing a behavioral health crisis. Many times these individuals don't belong in the hospital, and they certainly don't belong in jail.
The benefit of having a law enforcement officer that is aware of potentially interacting with individuals that may have had a mental health diagnosis or substance use diagnosis, and then knowing that there is sometimes trauma that's connected with law enforcement. So when you have an officer that can now recognize that, the way they respond is so much different, and there's a higher level of empathy.
This is the first time in the country all three prongs of the Crisis Now model will be implemented in one location. The spring and summer of 2022 gave us the opportunity to safely begin attending events again. And that was a key strategic initiative for us because we want to be face-to-face with people. We want to engage with people and share the resources that we have available here in Montgomery County. So one of the ways we looked at how we were telling those stories in 2022 is we looked at our social media, we looked at our website, and we knew we wanted to make some improvements. So we're very excited to share with the community that we have launched a brand new website, and we hope everyone will check it out. A huge goal of the website is to make it really easy to go to one place, and whether you're a provider or whether you're a community member, we want you in just a couple of clicks to be able to find all the great information you're looking for.
Oh, I'm so proud of what we've been doing with our diversity, equity, and inclusion work. Different people, different populations have different kinds of needs. And we've been able to recognize our responsibility for creating programs and other kinds of services that recognize those differences while still being totally accessible, as well as being able to help train our community about the importance of living out loud in a diverse community. I love our training division. I'm saying that out loud. I'm saying it because our training division are able to deploy hundreds of training opportunities, diverse kinds of training opportunities. Last year, we finally were able to add some team members to that work. Our training division here at Montgomery County ADAMHS is the largest in the state within any of our board agencies.
We also have MSA, which is Multi-System Adult, which was also targeted at helping to support individuals that are involved with multiple systems within our community. So one of our big pushes in 2022 and moving into 2023 has been looking at how do we support the familiar faces in Montgomery County that potentially continue to go to the hospital, get incarcerated, have to go to jail, even being in and out of the emergency room. Multi-System Adult is targeting that population so that we help support them in getting housing, getting their needs met. We were able to help one individual who has not been stable historically for most of their life. This is a young adult. They are now living independently through the use of Multi-System Adult dollars from the state. They were able to obtain an aide that works with them throughout the day. This is a level of success that is unprecedented for this individual. And we will also be taking the Multi-System Adult dollars to help work with Summit, which is a state hospital. We will also be working with our forensic centers for outpatient competency restoration, which all ties into this piece where we are wanting individuals at the lowest level of care so that they can stay in the community, they can stay with their families, they can gain employment, they can be independently housed, and it's all very exciting. The state providing the multi-system dollars is what allowed us to do this.
Montgomery County ADAMHS is funded primarily by the Montgomery County Human Service Levy, which is about half of our total money. And the other half is funded through the Ohio Department of Mental Health and Addiction Services, as well as some grants that we receive from federal, state, and local resources. We are very fortunate to have a budget of about $46 million. We support other ADAMHS boards in our region by processing their behavioral health claims. We've been doing that now for over 8 years, and it's another revenue source for us. We are the financial arm of the organization, so we have to provide clean audits. We take a lot of pride in when there is a state audit or a local audit or a State Department audit that we meet and exceed those expectations. We demonstrate our integrity through our actions.
We have a lot of talent in our organization, and that talented team is paying attention to the needs of the community and aligning with available dollars outside of our human services levy dollars to be able to bring in additional revenue. The dollars that they've been bringing in allowed us to return human services levy dollars to the Levy Council so that those dollars could be redeployed to other agencies that might not have those resource opportunities that we've been able to avail ourselves of.
We're very fortunate here at the ADAMHS Board to have talented staff that know how to write federal and state and local grants. We have to make application for these grants as they're posted on various websites, and then we have to write a narrative and provide a budget, and we really got to understand what the needs are in our local community, which we do.
We won a $2 million grant over 3 years. It was highly competitive through the Office of Minority Health. And what we're able to do is look at how we intentionally prevent suicide among Black youth in our community. We are addressing adverse childhood experiences and the potential impact of those. So anything childhood abuse, child neglect, any kind of household stressors create what we call chronic stress. And that has an impact not only on our physical health, but also our mental health as well. So the earlier we're able to intervene and give these young people the tools that they need to be able to be resilient and really understand that stress does impact their health and ways that they can let go of that stress is going to be huge. So we have committed partners through juvenile court, through children's services and the Board of Developmental Disabilities, as well as many of our behavioral health providers and youth serving providers who are really committed to making an impact and making a difference in our community. As I look back on 2022, I would say some of our biggest accomplishments as a team are the success of the Montgomery County Prevention Coalition and just, having almost 300 committed volunteers that are looking at how we change our environments to create better health for individuals in Montgomery County. I would say the launch of the Retailers Care, Retailers Creating a Responsible Environment has been huge. To have retailers that are so excited and to have our coordinator, Tanaya, really go out and forge relationships with them has been wonderful. Another big initiative would be the launch of the ACEs, the Adverse Childhood Experiences Aware program, and really looking at how we not only prevent a lot of the issues around mental health and drug addiction, but how we really go upstream and look at childhood trauma and the impact of that in so many of our systems throughout Montgomery County.
Since June of 2022, our last employee was an IT intern. We're very proud of that hire to get someone in to look at our equipment and update our systems. Things have been moving smoothly. We've changed our onboarding system to get employees to come in, so it's more seamless in terms of ID cards, parking passes, and just getting employees acclimated to ADAMHS. Some of our accomplishments so far has been updating policies, working with employees to understand what their needs are, to understand what some of the requirements are for ADAMHS employees. We've made a big campaign around benefits and getting employees to understand their vacation balances. We all earn a salary, but we all also have other fringe benefits. HR is here to help. We're not here to get in the way. Paperless is important to me. It's better tracking, public records request, it's easier to obtain, and it's more efficient and it's more secured. I've been in Montgomery County for 12 years now. This is by far one of the best places. I've felt a sense of community, a sense of making an impact. Not just from an HR perspective, but from a community impact.
The team has done so much with the community this year.
I'm very grateful to have a team that's dedicated to doing things right. Brian, Melinda, Mel, Rachel, thank you for everything.
They come to the table and they give their all, they give their input, they give constructive criticism, which I always appreciate. And they want to do the right thing. They see the issues that are happening in the community. And I would say the willingness of partners to come together, to sit at the same table, put differences aside, and really make a difference has been, it's what energizes me every day.
And then I'm really proud of just the fact that others look to us at the national level, at the state level. We just continue to get better and better at the work we're doing. And that's the thing that makes all of us feel really good about coming here. Not for the paycheck, it's for the satisfaction of making a difference.